Welcome to True Health Tuesday, and the truth will set you free. Okay, today we're talking about not how to abdominal surgery. We're just going to cover, because we have a number of people that are missing parts, okay? And when we're trying to get people back into normal and they're missing parts, it's a challenge. But in today's society, we're not really valuing what's going on with here. Now, we're not going to cover all the abdominal surgeries that can take place. We're just going to look at these four: gastric bypass, lap band, gallbladder removal, and appendix. So we're going to take like the basics. I mean, right now, bowel disorders in our society are, through the roof, epidemic proportion. So let's learn about how our body works and how to take care of it. Because if we had a rash of people going in and working on putting lap bands and doing gastric bypasses on water buffalo and, removing gallbladders and appendixes of beavers, we might think that the animals are defective. But, in us, we forget that our bodies are intelligent. They've been designed to live here, and we don't have spare parts. When you're looking at the digestive system, we're looking at a vital system that has a function that's evolved to thrive on this planet over millennia. Now, the thing that controls this digestive tract, and you'll see when you put food in your mouth, your nervous system is already working. Okay, it's producing acid. It's getting the gallbladder ready to secrete bile. The food goes in the stomach where it's broken down and digested, because the only way that we live is to break proteins to amino acids, fats to fatty acids, and carbohydrates to usable sugars. So this entire system on the right-hand side, it's the outside of the world inside your body. And it's literally a way to break down anything you put in your system into this intestinal tract so your body can utilize every nutrient. And so the only thing that you eliminate is waste products. So this is super efficient, designed to thrive from the Arctic to the Sahara. Okay, amazing. And it has purpose. Everything in it has a purpose. Now, when you have this automatic nervous system govern it, we have one part that activates under stress. That's the sympathetic nervous system. That's the fight or flight. That's located in the thoracic area. We have the parasympathetic, which is the rest, digest, and repair, and that governs this. We actually had a patient who was looking for a vagal block. The neurologist wanted to block her vagus nerve because, she was 3 years old and had reflux problems. Yeah, so there's such a disconnect between the normal function and what we're accepting. We're accepting that the gallbladder is bad and we take it out. We're accepting that the appendix is bad and we take it out. We're accepting that you have reflux for no reason whatsoever, that you need the little purple pill. We're accepting that this system that's designed for health and for survival isn't working right. So we have to look at this ecosystem a little bit different. Anything you put in your mouth, in order to utilize it, has to be filtered through the wall of the intestinal tract into this portacaval system, filtered up through the liver. Now, the way this system works is there's about 2 to 3 pounds of bacteria inside of that intestinal tract. Now, it produces vitamins, it produces nutrients, it helps break down nutrients. It's essential. Now, in that large intestine, we have 85% good bacteria, 15% can be pathogenic. But all bacteria in there, they're eating yeast, they're eating candida. It's an ecosystem. It has a world of its own. Anything that we do to this ecosystem is going to harm it. Okay, it's designed to be healthy. It's designed to have healthy bacteria. So if we take anything that kills bacteria, harms the ecosystem. It's like I got the fish and the coral there. Anything that you introduce into that ecosystem, it's not going to be good. It's like, what can you put in the Sahara that would make it better? What could you put in the rainforest that would make it better? Now, medications are going to disrupt this ecosystem. okay, any medications. Every medication is going to slow or stop a metabolic process or block a receptor site on a cell. This means blood pressure, medications, antacids, estrogen, or antidepressants, antibiotics, cholesterol drugs. I mean, all of these are going to interrupt it, because when you put that broccoli in your mouth, it goes down your esophagus, into your stomach, through the duodenum, and then it goes into the small intestine, the large intestine, and it gets broken down and absorbed. The fibers that can't be absorbed actually help the muscle activity of the large intestine. If you put that beta blocker or diuretic in your mouth, it goes down the esophagus, into the stomach, through the wall of the intestinal tract, into the liver. Then it goes, dumps into the inferior vena cava, goes to the heart, which sends it off to the lungs, gets back to the heart, and then out through the body. So everything that you put in the mouth is going to affect your health, positive or negative. The doctors of the future, they're not going to go in there and say, gee, you've got depression and anxiety. You need this drug that has a black box warning that says it can cause suicide or suicidal thoughts. They're going to think, my God, if we give a chemical to this person, how does it affect the entire body? Does that make sense? If I give you a non-steroidal anti-inflammatory or suggest it, okay, how does that affect the entire ecosystem of the body? Well, gee, doc, you know, I heard that non-steroidal anti-inflammatory destroys proteoglycan production, blows holes in the intestinal tract, damages the kidneys, and you're prescribing it for what? Oh, pain. Okay, those kind of doctors, you take pepper spray out and shoot them. Okay, so let's look at the cause of this. Okay, you know, that's fair. I'm not saying shoot them with anything other than pepper spray. Okay, so we're going to look at these surgeries. These surgeries has a causative factor. They have things that cause it. When we look at gastric bypass, lat band, and gallbladder, those are all physical, chemical, or emotional stress load. And you might think, well, isn't that for weight loss? Isn't that is it for weight loss? What's causing weight gain? We're going to go over the neurologic aspect of that. Now, the appendix, this has to do with disruption of the gut flora. Now, the appendix is interesting. We actually had one of the sons of one of the gals that works here, he had his appendix out. Now, he's got a number of lifestyle challenges, okay? And not a real healthy lifestyle. And so when he came in here, because he doesn't get adjusted, doesn't eat right, you know, anybody have a kid that doesn't follow your advice? Okay, good. Just looking for some identity there. Okay, I said, you know, so the surgeon took out your appendix. Did he tell you what it was used for? He said, you know, I asked him, and he said it was back when we had tails. Okay, we had tails, and I thought, wow, cool. So you got a piece of the intestinal tract in a tail that's vestigial. Okay, so we're going to find out what the appendix actually does. But when we look at lat band, gallbladder, gastric bypass as physical, chemical, or emotionally stress-related, how does that work? See, remember, this gastrointestinal tract has evolved to get the maximum immunization with the minimum of waste, because we're designed to survive on this planet. We're not designed to live in a nutrition-poor, calorie-rich environment. And also, if you're under stress, physical, chemical, or emotional stress, what happens? The blood supply to the gut shuts down. So you have this combination of a high-stress lifestyle, which means slow gastric motility. You're not going to be able to break it down. And the body's so smart that if it takes this nutrients, it can't utilize it, but it doesn't want to lose it. So what does it do? It forms it into the most complex or calorie-rich molecule. It's called lipose, fat. And it stores it. You get 9 calories per gram of that stuff, and you store it. So if you can't utilize it, you store it. So if you're under stress, you can't break it down. You're not going to break those fats to fatty acids and carbohydrates to usable sugars. You got to store it. And where are people storing it? Belly, seat, and thighs. That's cortisol weight distribution. So you start looking at this, it's like, oh my God. So it's really not overeating. It's a person under stress, Because what happens if you're in this fight or flight state? You're always stressed. You're always working hard. Are you happy in this state? No, you're just trying to survive. So we get all of these people in the stress state. How do you initiate that parasympathetic response? And this is really, really important that you get this, because if you're under physical, chemical, or emotional stress, do you have the sympathetic response going on? Yes? Yeah? Yeah, for sure you do. Okay, so what are you going to do? What are you going to do? How are you going to calm down? How are you going to calm down? Okay, watch a couple of Joe Pesci movies? No. You go to the drive-thru. They messed with you at the drive-thru. No, you can't do this. So what you do is you have to calm it down. So how do you stimulate that parasympathetic? You eat something or drink something. You get that, or you do something. Take a Benadryl. Whatever you do, you're going to take a drug, take a chemical, eat something, and that calms down that sympathetic dominant state. So you look at people who are morbidly obese. They've got physical, chemical, and emotional stress. They are not overeaters. They are in a chronic stress state, and they're doing everything they can to balance that autonomic nervous system. They are in a completely stressed state. Okay, does that make sense? So if you're going to bypass their intestinal tract with a surgery, or suggest any diet changes. This is why diet changes don't work if you don't look at the physical or the underlying stressors. You have to correct that. You got to correct the problem. And you can also correct the environment. Are we living in a nutrient-poor, calorie-rich environment? Yeah, but do you have choices? Yeah, it's called plants. Okay, so do you know why I put the puppy on this slide? Yeah, parasympathetic. Dude, I look at a picture of the puppy and I feel better. I know. Okay, so when we look at this, let's say that you've already had the gastric bypass surgery. And this is what they actually do. They're going to cut a portion of the stomach out, move a part of the small intestine, and cut it up there. There's also a couple more different types where they'll actually cut and remove portions of the stomach. Now, when you get this surgery done, you're told you have certain diet restrictions. I know. I was thinking, you're kidding me. Damn, I get part of my stomach cut out. Can't I just eat the same stuff and you won't be able to bug? No. Okay, so what they're recommending, now think of this. You got a morbidly obese person, okay, that's completely stressed out. Otherwise, they wouldn't be morbidly obese. It's like, how many people doing drugs today, and I'm talking meth, heroin, cocaine, opiates, the real hardcore stuff, like the antidepressants, the Wellbutrin, Depakote. Does anybody on the planet think that those drugs are really beneficial for them? Or do they understand innately that they're eventually going to have a toxic negative effect? Absolutely. So people know that it's not good for them. But this is the diet restriction. After you've had your gastric bypass surgery, it's vital that you have foods with good healthy fats like avocado, salmon, nuts, sardines, coconut oil. It's vital that you choose lean meats. Okay, they're recommending canned tuna and salmon, great, okay? But avoid greasy and spicy foods. Avoid whole milk. Now it should say whole pasteurized milk. Eat nutrient-dense foods such as whole fruit, vegetables. Plan your meals. Involve your family in healthy eating. Eliminate or limit desserts. Don't tempt yourself with a pantry full of junk food. Eliminate fast foods. Eat out only on occasionally. Separate water by your food for at least 30 minutes. What do we recommend? No water a half hour before a meal, no water during a meal, no water a half hour after a meal, because you want to build up the stomach acid so you can utilize the nutrients so you're not going to store them. Eat smaller meals. This is what you have to do after you've had the operation to cut your stomach out. Okay, now let's do the lap band. Now the lap band's got a number of different challenges. We're going to go into the challenges, okay, because if you've already had that bypass surgery, you're going to have some severe challenges. We're talking about nutrients, and we're going to talk about how to solve it. But hopefully we can catch people before they get the surgery. If they've already had the surgery, you're going to have to adapt to it, and I'll show you how. But let's say you have the lap band. Now, if you have the lap band, this can actually damage the wall of the stomach, and you have a foreign object in there, which is going to create long-term inflammatory responses. Now, this says you got to take 20 to 30 minutes to eat a meal. Now, if you're eating and you start to vomit, that means the band is pinching off, the amount, because if the food can't go through, it's going to come out. Don't snack in between meals. Stop eating as soon as you're full. Don't eat if you're not hungry. Hey, dude, it's 11:30. Let's go to lunch. No, I'm not hungry either. Come on, let's go. You know what I mean? It's a social thing. We're not designed for that. This digestive tract designed over millennium is designed to eat whatever we can find. And it was never this type of food. Don't drink anything before a meal. Use smaller plates. Does anyone understand the diet restrictions that they're having after the gastric bypass or after the lap band? If they did those initiating, and if they dealt with the physical, chemical, or emotional stress load, does that make sense? More further warnings on the lap band. Calories still count. Read the food labels. Don't eat foods that contain lots of fat, sugar, and carbohydrates. If you're going to drink alcohol, it'd be better to not. Avoid alcohol. Don't drink fluids that have lots of calories. Avoid sugary sweets. Does this sound like advice that every doctor on the planet gives? Okay. It's crazy. Now, the effects of a lap band surgery, you might call them side effects. They're actually effects. Blood clots, bowel function changes, bowel perforations, esophageal dilation because you're backing stuff up. It can't flow down through. Reflux, gallstones, so you can get your gallbladder out too. A lot of times they'll take the gallbladder out when they're doing this just because they know it can cause problems. Honest to God, this is 2018, okay? So when we say dark ages, this is it. Food intolerance, vomiting, pneumonia, port problems, pout dilation. It only happens about 30% of the time. So when I post a video every day, every morning, it's about 1 minute to 2 minutes long. And I said, the more parts you have, the easier it is for me to work on you. Really, I posted that. And I get people in here, 40, 50 years old, and I say, really, you have all the parts? Well, yeah, of course they took out my tonsils because that was the fad back then. And, I've had the gallbladder removed and the appendix, but those aren't the real parts, are they? Okay. This gal, and I want to read this because this was beautiful and brilliant. She had gone through this. There's a typo in here that I didn't correct, by the way. In 86, she weighed 238, I'm guessing pounds. I'm only 5'1", had stomach stapling done, and they had removed the gallbladder, saying it was routine for this type of surgery. She lost 100 pounds, and within a few years, her stomach stretched back and she gained it all back. Why? Because they didn't fix the physical, chemical, or emotional stress load. You were so right, you have to change the diet to be healthy, which she did in 2003. The paleo diet lost 93 pounds and kept it off. The only thing about that surgery I want people to know is that over the years, it caused her to have 3 more surgeries for hernias, and now she has a bear of a time digesting fat and meat. I regret having my weight loss surgery every day. Certainly I would tell anyone to not have that kind of surgery. Please just change your diet. Gallbladder. Okay, so if you're contemplating this surgery, do the diet changes that you're going to be required to do after the surgery. Do the diet changes for 6 months and look for someone to help you with the physical, chemical, and emotional stress load. Does that make sense? If you're taking medications that are damaging your gut flora, okay, find out why you're taking them. If you have type 2 diabetes, which is a blood poisoning, look at Dr. Gabriel Cousins' work. Look at Simply Raw, the video on YouTube. Find the problem and fix it. You're going to be going plant-based for about 30 to 60 days, and your type 2 diabetes will go away. I mean, it's really that simple. Removing a gallbladder, cholecystectomy. Okay, now if you look at, we're just going to call it gallbladder removal. Anybody know the name of the gallbladder in Spanish? It's so pretty. Vesicula biliar. Vesicle of the bile. I mean, it's just, damn. I mean, that's pretty language. Okay, so now they have post gallbladder removal syndrome. Okay, now it's caused by bile leakage. because the gallbladder does, it stores and concentrates bile. So when fat hits that duodenum, which is right next to the stomach, it contracts to emulsify the fats. Now you might say, where does the gallbladder get the bile from? Well, it gets the bile from the blood. The spleen goes in there and checks all these red blood cells, which only last about 120 days, takes that red blood cell, passes it over to the liver, and the liver breaks it down to the protein constituents. This is where gallstones come from. Gallstones come from people who have high stress, physical, chemical, and emotional stress. What happens under that stress, remember, this is from blood and it's storing and concentrating it. We were doing studies back in the late 90s on cardiac palpitations over at Cleveland Chiropractic College, and we were looking at the constituents of a gallstone. And it turns out it actually is made of stress hormones. So we're talking adrenaline, epinephrine, norepinephrine, cortisol, all of those stress hormones. So people who have high stress have high gallstone formation, okay? Now, if you've lost your gallbladder, I mean, not like, damn, did someone see it? It was here. I mean, if you actually had it removed, okay? Because honestly, we'll actually do a physical exam and people will say, oh, have you had any operations? I don't know. Okay, did you ever wake up in a hotel room in a bloody sheet missing a kidney? You know, I mean, it's just like, dude, you've been alive in this body. So heart disease, learning difficulties, nervous system function, blood sugar control, osteoporosis. Why? Why would you have these problems if you're missing a gallbladder? Because the gallbladder stores and concentrates bile. It's vital to emulsify fats. Without fatty acids, you can't produce hormones. Now, you're still going to be able to digest because you've got this bile acids continually leaking into the intestinal tract, so you're going to have to increase your fats. Not once in 22 years have I had one patient come in and said, you know, doc, the doctor that ripped out my gallbladder said I should increase my fat intake because I was going to be hormone deficient, my hair was going to fall out, I was going to have learning disabilities and everything else, and he told me to alter my diet. Not once, not once. Now this is some of the effects, and I know it's too small of a type, but bleeding can occur after you've had your gallbladder taken out. Bile leakage, and this means not into the duodenum, I mean into the peritoneum. And it's designed to emulsify fats. Injury to the bile duct, don't worry, that only occurs 1 in 500 cases. Injury to the intestine and bowel, that's only 1 in 1,000 cases. Deep vein thrombosis. Why would the deep veins in your legs start to back up? Risk of the anesthesia, tummy pain, indigestion, diarrhea. Look at this. The body gets rid of cholesterol or balances cholesterol levels through the bile. We need cholesterol to produce all the hormones. 50% of your brain's weight is cholesterol. So if you're not able to break down these fats, it's obviously going to negatively affect the brain. Now, the statins, cholesterol drugs, and in this crazy world, we're prescribing cholesterol drugs to lower cholesterol. Cholesterol is utilized for hormone production, inflammation, and brain function. It's just beyond stupid that a doctor would lower cholesterol without understanding its function. But then again, they're taking a gallbladder out and not thinking that it's going to be a big deal either. If you're taking estrogen, this can actually damage the gallbladder. So when we have that list of medications that can negatively affect the digestive tract, understand hormone medications can negatively affect the gallbladder. Birth control pills can cause this. And any healthcare professionals in here? I know, Doc, you. Okay, they have a mnemonic, okay, for the gallbladder. What is it, Doc? 40 fertile, female, and full. Okay, so, and those are the 4 F's for gallbladder. So, because you're always taught to spin this diagnostic wheel to find out what's the right diagnosis. You know, I got a choice of 4. Okay, what is it? Okay, abdominal pain, but they're a 50-year-old man. Oh shit, it's not going to be gallbladder. Okay, you know, is he a smoker? Does he have prostate issue? You know, I know. That's all it is. It's multiple guess. Okay, they're not taught critical thinking. So when you look at this, you have to be taught critical thinking. After the gallbladder is removed, pancreatic inflammation. Why? Because the gallbladder and pancreas drain through the same opening. damage to the pancreas, leading to diabetes. Why? Because you got this consistent drip of bile. The constant drip of bile can irritate the duodenum, leading to pancreatic ulcers. Okay, now here, gallbladder removal and the risk of developing colorectal cancer. Okay, so it found it increases, a significant trend for increased rectal adenomas. Why? Because hormone problems, fat emulsion problems, you're totally destroying this ecosystem that's been designed to have you thrive on this planet. Increased risk of depressive disorder following cholecystectomy for gallstones. So again, depression and anxiety. Why? Why? Could that be because we're not absorbing fats because we can't get appropriate hormones? Increased risk of peptic ulcers. No kidding, because I mean it's dripping bile inside of the duodenum without any food in there to absorb it. It's just mind-boggling. So what do you do if you've had your gallbladder removed? Well, avoid processed and commercially packaged foods. Avoid fried foods and toxic oils. Now, is this good advice for anyone? No, you in the back, you can have the toxic oils. No, I love you too. After the gallbladder removal, you got to have high, healthy, saturated fats because you're not going to be able to absorb them. You know, a little bit of coconut oil with every meal because you need the fats because that bile's always dripping in there. High fiber. Why? Because having the gallbladder removed, it creates a diuretic effect, and food goes through your system too fast, you're not going to absorb it. It can have a laxative effect. So adding healthy, fresh plant fibers to your diet is vital. You're going to have to take supplements. Ox bile might be helpful. Digestive enzymes, lipase, because you can't break down the fats. Now let's look at the appendix. The appendix is not a vestigial from when you had a tail. Okay, it's actually vital. It's part of the immune system. Now, what Duke University is saying here is it's lymph tissue, so we know it's an immune system involved. It's got a sac. Now, the sac contains bacteria. So what if you've had a problem with the intestinal tract? What if you've had dysentery, cholera, or you know, some problem? Like let's say you've had a colonoscopy, where you've taken a damaging chemical that destroys your kidneys and evacuates the entire intestinal tract of the 2 to 3 pounds of bacteria that you need to survive on this planet. Well, how do you repopulate the intestinal tract? The appendix. It helps it. Now, what's amazing, multiple journal articles are talking about how the appendix is vital to repopulate your intestinal tract with healthy bacteria. I mean, of course, Professor Bill Parker says it's very important people understand that their appendix gets inflamed. Just because it has a function doesn't mean they should keep it. Okay, that I'm total agreement. But what causes it to inflame? What causes it to be damaged? You know, we got to look downstream. You can't have these morons saying, well, yeah, if it's inflamed, you got to take it out. Don't ask me what causes it to inflame, because I ain't going to tell you, because I don't know. I thought it was part of a tail. Honest to goodness. Okay, biofilms in large bowel suggest the apparent function of the appendix. Again, another journal article saying that it's a safe house for bacteria, where it can repopulate the entire digestive tract. It's like amazing. Now, over 300,000 people are having this removed every year. Now, it repopulates the intestinal tract. So why are 76,000 of them are kids? So if you've had your appendix removed, you have an increased risk of colon cancer. You have an increased risk. Why? Because we're not able to have healthy digestion. So what causes the appendix to malfunction in the first place? It's got bacteria in it and it's lymph tissue. So if you do anything to the ecosystem that damages that intestinal tract or damages the normal flora, it damages you. Okay, does that make sense? So antibiotics, chlorinated water. Do you know when they started to chlorinate water, appendicitis has skyrocketed in the early 1900s? Genetically modified foods. Why? Because those have antibiotic properties, processed sugars, contraceptives, most medications. And if you've had damage to the appendix, look for allergies, asthma, colds. The appendix, and again, this is brilliant, derived T lymphocytes, B lymphocytes. It's vital to the immune system. So what causes damage to the appendix? Well, what they're finding when they actually remove this appendix, they're looking at it and they're thinking, dude, what's in here? Well, they're finding a pathogenic bacteria. See, in your intestinal tract, 85% good bacteria, I mean bacteria that aren't going to really cause a problem, and they keep this 15% bad bacteria in check. Now, what if you were to expose your intestinal ecosystem to animals that were sick, diseased, something that if you were a hunter, you would thought, oh, hell no, I ain't gonna shoot that sick little shit. I'm gonna feed that creature to my family? Hell no. Okay, you would pick a healthy animal. Okay, you're not gonna pick this one with sores everywhere. However, that's what we're eating. When you get a burger or chicken, burgers don't come in little plastic things with food coloring sprayed on them. Have you ever taken a steak out before you knew that a steak was sprayed with food coloring and you flip it over and it's all gray on one side, but the side that people can see it's all red? Yeah, we had a patient bring us some steaks and they brought it to the boat and I thought, wait a second. This isn't hormone-free and range-free. This is like from Albertsons. Wow, what a trip. It's like red. Okay, and then you open it up and you flip it, it's gray on the other side. No, I'm going to make you something else. You know, thank you very much. I'll give this to my dog, you know. But this, I know, no. I like the dog too, okay? Okay, now, so what are they finding out in these appendixes that they're taking out? They're finding E. coli 88% of the time. E. coli is rampant in this toxic food. So the toxic food that you're taking in is damaging your appendix. And what kind of other things can damage the appendix? Antibiotics, chlorinated water, infant formulas are made with toxic soy, processed sugars. Now, then you look at this, Journal of Gastrointestinal Surgery. What patients and surgeons should know about the consequences of appendectomy for acute appendicitis after the long-term follow-up factors influence the incidence of chronic abdominal complaints. We've taken it out, now we're going to look at what happens long-term. Kind of like the new vaccine that they have for adult hepatitis. It does cause heart attacks, but we're going to try it on the public and see how it works. Don't worry, the company is going to be okay. It's called Dynavax. They took away the liability, so they won't get sued. So our data enables surgeons to inform patients about the long-term results of appendectomy, whether it was complicated or not. And they're finding abdominal problems. Why? Because they can't repopulate, and they never fixed it in the first place. Association between appendectomy and colorectal cancer. Okay, likely associated with development of colorectal cancer in the post-surgery period. Why? We haven't, are you tired of me saying this? Ecosystem. If we damage that ecosystem, our body doesn't function well. We can't fight disease. This is where the largest immune system organ you got is the gut. Now, you'll see this picture up on the upper right. Okay, that's what classical stuff. You see at the very bottom on the left-hand side, which is actually the lower right quadrant in an abdomen, you'll see a little tiny thing sticking out there. Okay, that's classic. I mean, I've dissected hundreds of bodies. I've seen them this long. I've seen them go up the ascending colon over to the transverse colon. I've seen them all over the place. But doesn't it make sense? You got the small intestine dumping into this big bag here called the cecum at the lower, inferior aspect of the ascending colon. And then you got the appendix hanging off of that. And the appendix, I've literally seen them about 2 feet long. I mean, it's amazing because it has a function, not from when we had a tail. So all of the things, and we're talking all of these surgeries, if you've had it, you have to change your diet. If you want to avoid it, you have to change your diet. Anybody got a problem with that? We're designed to live here. So you got to get your nervous system checked. Why? If you're in a stress state, we were talking to one patient about addictions, okay? Is this helpful in solving addictions? Absolutely. Why? Because people aren't going to be doing drugs, they're not going to be doing alcohol unless there's a physical, chemical, or emotional stressor. If you don't fix those three stressors, they're going to go back to doing the drugs. Antibiotics. Do you go to fast food restaurants? You're going to get the glyphosate, you're going to get the toxic meat products. Remember, think of that. Would you shoot that cow that's been given hormones for 6 years to keep them pregnant and they have sores all over their skin? Would you take that and drive a spear through it and bring it home to your family? No. Okay, GMOs. Avoid them like the plague. They're soaked in glyphosates. Vaccinations. This causes a leaky gut. It causes a number of different, they call it ileocolonic hyperplasia, where that ileum comes into the colon, it damages that area. Processed foods. The only reason they process it for shelf life. If bacteria don't want it, you shouldn't either. Okay? Yeah, you want stuff that molds. Okay? You want stuff that rots. Organic plant-based diet right now for everyone. Okay? If we're not reinventing the wheel. There's people on the planet that live healthy beyond 100. Let's just do what they're doing. And when you see it, that the majority of them, if they eat meat, they eat it once a week to once a month. That's it. They eat healthy, seasonal, organic, plant-based. Fermented veggies with every meal. Why? Because we're in a sea of stuff that kills our normal gut flora. We get healthy gut flora, we're okay. Probiotics, juice vegetables, blended fruits, raw dairy, once your gut's healed. Fermented foods with every meal. This is how we used to preserve foods. We need bacteria in our gut. We need it. And look at this, antioxidants. If you have inflammatory diseases, and we've covered inflammatory bowel diseases, ulcerative colitis, Crohn's disease, all of these are inflammatory diseases. Inflammation is not the problem. Inflammation is not the problem. Okay, inflammation means there's tissue damage. So you get these people saying, man, gotta solve that inflammation. No, you don't. You gotta find where the tissue damage is. Duh. Okay, joint inflammation. No. The joint's being hurt by something, compromised blood supply or nerve supply. You're not going to take an anti-inflammatory like Motrin, Advil, Aleve, okay, because that destroys the joint cartilage. That's stupid. You must be from 2018. Yeah. Dark chocolate. Yes, it's good for antioxidants. Anyone need permission to take some? Okay, but get the pure, 100%, so it doesn't have any soy lecithin in there. And if you want a little sweet, dip it in some Manuka honey, and you got a guilt-free bit of joy there. If you're going to eat grains, and grains are okay, we've been doing it for tens of thousands of years. Make sure they're sprouted, make sure they're organic, make sure they're ancient. But if you have a leaky gut, you can't have it. So until you fix the gut, and you fix the gut, Hashimoto's goes away, diabetes type 2 goes away, you start to do weight loss. Everything works. Can you see why we put these here? This is the solution for, it's actually not a solution, it's more a plan. This is how we were designed to live here. We need a healthy nervous system. Why? We get it from movement. We need regular exercise every day. Proper nutrition, if it looks like food, it's probably food, if it doesn't come in a package with chemicals. Rest, meditation. Now, we've got all of this, okay, and this is digestion month. Next week, we're going to be talking about colon health, like how to maintain a healthy colon. And we've got extremehealthchallenge.com, which is a blast. Okay, we got a 14-day challenge. We're going to have a 14-day challenge next month. Next month, I won't tell you, but it's on hormones. Okay, it's going to be a blast. This digestive month was really fun too, but next month's going to be really a blast. Okay, so now next March, about a year from now, I'm going to take you to Cuba. Okay, does anybody remember the old Saturday Night Live when we were getting airlines hijacked and they said, please take me to Cuba? Yeah, well, we're actually going to go. So I just think it's going to be cool. So go to our website, go to everywhere you can, sign up for it. It's going to be a blast. The lineup of speakers that we have, I don't have them locked in yet, but yeah, I think you'll like them. Dr. Wakefield's going to be cool. Okay, now, any questions? Yes, sir.
How do they determine the amount of stomach that they take out?
How do they determine, because I got to repeat it because I got the only mic, how do they determine the amount of stomach they take out? Good guess. It's a guess. It has no, you look at it, and because how big is the stomach? It's like, does everybody know that a uterus is about this big? And today I adjusted a gal with 2 kids inside of her, and it's now this big. So a stomach's going to expand and contract a bit, not as much as a bladder or a uterus, but it's a total guess. Yes, ma'am.
What do you do if the appendix would be inflamed or gallstone would give you, would hurt, and you go to the hospital and they say...
Interesting. What do you do if the appendix is inflamed and it hurts and you go to the hospital, or the gallbladder's inflamed? What they do in Europe is radically different than here. Remember how 85% or 88% of inflamed appendixes had that pathogenic bacteria, E. coli? Turns out in Europe they treat it with an antibiotic. Okay, now this is weird because antibiotics caused it by creating a non-competitive environment, but antibiotics are phenomenal for it. What we'll tell people is, put moist heat on it because you want to increase the inflammation, and heat is going to start to knock it down. But if that appendix has been so damaged by a toxic deficient environment, it could be life-threatening if that baby bursts. But also, most of them don't burst. But in this country, it's a litigious society, so we'd much rather rip it out of you and not risk any liability and just say to heck with it. Man, once we've ripped the appendix out, you ain't my problem anymore, okay? I don't have to worry about your diet, lifestyle, or anything. So if you develop colorectal cancer or some type of, increase of colon cancer, you're not even on his radar at all. So that's the tough part. But in Europe, they'll do it with antibiotics. In this normal world, we would say put moist heat on it, but that's a really tricky situation because if it does burst, you're in deep trouble. They're going to have to flush it out with antibiotics, but it only happens from long-term toxicities. And then you look at the gallbladder. The gallbladder, you can do a gallbladder flush, but most people that have had gallstone issues, what are they like? Healthy, normal, great diet, physical, chemical, emotional stress all handled. No, you're talking extremely stressed people, slow gastric motility. They can't do a colon or a gallbladder flush because they're doing 1 poop a day if they're lucky. Okay, so this is a very, very stressed individual. What we'll actually do, there's a soft tissue adjustment that we can do that can move stones through the duodenum down, that you can literally move it through, and that helps. But it's amazing. It's painful as all get out, but it works. And then make sure that the blood is healthy, so they're getting plenty of healthy fats, healthy water, healthy fluids, healthy bacteria, fermented foods, and their body will heal.
So you take a painkiller and go home?
Not a painkiller. No.
Well,
if you have that pain
like crazy in the hospital.
In pain like crazy in an American hospital, they'll give you a pain reliever and schedule you and a steroid and possibly an antibiotic. Okay, so in Europe they'll give you an antibiotic. Okay.
So you just take the antibiotic.
Yeah, and then you listen to this and you think, damn, I never want to go through that again. I'm going to start eating fermented foods, sleep right, I'm going to get my nervous system checked, and you'll be fine. Yes, sir.
What about the gallbladder flush with olive oil, apple cider vinegar with the mother and olive oil?
Okay, what about the gallbladder flush with olive oil and grapefruit juice? Works fantastically well, except what if you've had chronic stress, physical, chemical, emotional stress? What we've got to do when we're working with people, and you got to figure, we get people post-surgery, cancers, I mean, every type of level of stress you could imagine. And we don't even talk about nutrition for the first week because they're in that sympathetic dominant state. Then we start talking about nutrition, and we teach them about how to get deep sleep. We teach them how to get healthy bowel movements, because if you're doing a gallbladder flush where you're contracting that gallbladder and it's dumping that bile and fatty acids into a duodenum that's got slow gastric motility, you know, 1 poop a day if they're lucky, that's a toxic situation. So they're going to be absorbing the toxins. So you want to get them up to 3 bowel movements a day, and that's going to be, what do you think? How do you get somebody up to 3 bowel movements a day? Plant-based? Oh, that's a good idea. Okay, heavy plant fibers, that's a great idea. Juicing and blending, that's good. Are we going to get them to sleep better too? Absolutely. It changed their mind doing neurolinguistic programming. And then we send them to a colon hydrotherapist. Okay, we're going to talk a lot about that. Did you know, like that? Yeah, bad memories with that one, but you know, still got to do it. But when you do it, you know, they got to get a series of 3. So what we tell them is over about a week and a half, you're doing the diet, you're doing the 3 bowel movements a day, you get a colon, you know, hydrotherapy session that flushes you out, then you get a second one a couple of days later, and then the night before your 3rd colon hydrotherapy session, you do that drink and you sleep on your right side so it increases the pressure there, and then that helps because the grapefruit juice is going to initiate the contractions and the fat inside of the duodenum is going to cause it to contract. So you can really do it. I mean, the challenge is if a stone can actually get stuck and block the pancreas, but that is ridiculously rare. I've never seen that happen. I think it's like urban legend stuff. But you know, you've got to be under the care of a real doctor, not somebody that wants to remove a gallbladder. I mean, somebody that understands how to gauge, to make sure that bile duct is clear and you could actually feel it. If somebody doesn't know how to feel it, then they shouldn't even be recommending it. Okay, does that make sense?
Yeah.
Yes, sir.
You briefly touched upon colonoscopy and how the preparation can damage, you know, to clean you out, it does the damage. Do you care to comment more on
Okay,
how often we should get?
okay, I gotta like, how often we should get a colonoscopy? How about never? Okay, yeah. Okay, I briefly touched on colonoscopies, how the prep on it can damage your intestinal tract. Yeah, we talk an entire hour on colonoscopies. And this goes with all tests. If you're doing a test that damages the system that you're trying to protect, it's probably not a good test. You know, I'm just talking like common sense, like mom would tell you, okay, or my mom, okay. And the colonoscopies, I only did the research on it because we got a good book up there, Science for Sale. The chemical they give you to evacuate the bowel, it only evacuates about 60%. And then you're damaging the entire gut flora, and that's 80% of your immune system. And then it also gets through the wall of your intestine into the kidneys and can damage the kidneys, can cause heart problems, it can cause long-term damage. The act of shoving a camera up there can spread bacteria and can actually damage the tissue. And the only thing they're looking for is polyps, okay, or destroyed tissue. Now the polyps, when they cut off, they say, well, these can magically turn into cancer. I'm looking for that, and I hear urban legend stuff, but I haven't seen a study that shows that polyps, polyp made of healthy, normal tissue, okay, which is what they are, it's just a weakening of the wall of the intestine, can magically turn into something that attacks the colon. What you can see is that a toxic deficient lifestyle damaging the normal gut flora with chronic stress, weakening that peristaltic wave, weakening the wall of the intestinal tract, leading to damage of the intestinal tract so far that compromised blood supply, nerve supply, and intestinal flora can lead to colon cancer. Absolutely, that's bad, and you can see that with a camera, but you're damaging the tract. So how do you find the one thing that you want to find out? That destroyed, damaged material, okay, that's eating up your colon, that's going to be attacking your body. You do a fecal occult blood test. You poop in a bag. It's non-toxic, non-invasive. You'll find stuff. But wouldn't it make sense to just get a healthy colon in the first place? And a patient today, 8 colonoscopies. 8. every time you do it, you're wiping out the normal flora. And it's like, damn. I mean, we had one guy in here, and he was young. He was like 35, 36 years old. And he had 5 colonoscopies and was going for his 6th. And I said, why? And he said, well, gotta find out what the problem is, doc. And okay, how many bowel movements a day do you have? Nah, 1 every 3 days. Okay, was he stressed or not? Absolutely. What's his diet like? Oh, I hate vegetables. Okay, how many medications are you taking? Well, an antidepressant, a blood pressure, and a cholesterol. Okay, so you're like ridiculously stressed. Are you taking an antacid? Of course. Every time I eat something, it backs up. No shit, it's full down there. Well, I can't say no shit in that case. Okay, so you know what I mean? You know, healthy body. You know, we do need surgical interventions, but not when it's going to damage the body. And next week, we're talking about colon health. Healthy digestion. Live healthy. God bless you.